Dr. Nomsa Chali, Dr. Colleen Nomsa Chali, and she'll share a little bit about herself in the introduction, but also would like to introduce Suliwo. I believe Suliwo's on as well. Oh, Cheetah is on. I didn't see
Good
her,
morning.
but she is the moderator. I was just going to like roll along because you know,
no,
we like
I see
to save
that.
time. So with that said, I will step back and introduce our moderator. Cheetah Kabula, it's all yours. Go ahead.
Thank you, Dr. Frida. Good morning, everyone. I'm so excited to be here with you guys talking about this very important topic. I'm Cheetah Kabulo. I am a Zambian based in Atlanta. By day, I'm an advisory manager at Deloitte & Touche, where I service our financial services clients. But I'm also very passionate about giving back to my community. And so I work with Dr. Frida on Zambians Promoting Leadership in America and Bella with AZA. And I also work on an organization called Selfless for Africa. So I try to keep engaged in my community and give back as much as possible. So this topic of mental health, I think, is very timely as we head into being with our families on top of the stress of the year that has been so far. So without further ado, as Frida was about to introduce Nomsa, Nomsa, if you could give us a brief background about yourself and then share your prepared remarks. And for everybody who's joining us for the first time, I see a few new names. The format of this presentation is Nomsa and Willow will give a few prepared remarks, and then we'll dive into Q&A. I've received a few questions beforehand, but I encourage you all to also share your questions through our chat feature. Today's session, I think, will have a high level of engagement, so whatever questions we don't get to, we'll try and respond in a written format and share that with you at some point after the session. So Nomsa, if you want to kick us off.
Thank you so much for inviting me. It's really a pleasure to be part of this wonderful group. Sounds like a very interesting stuff going on that some of us haven't been privy to, but it's wonderful that we are, I'm participating today. Thank you. I'm just going to share my screen real quick. Frida made me make this presentation. I was being lazy, but I think I tried. Let's see what I can share real quickly. Pardon me, let me just put it in presentation mode. Okay. All right. Can you see my screen?
Yes.
Oh, we can see your screen.
Thank you so much. Okay. Let me just, okay. So really, just a simple introduction about myself. My name is Nomsa Mwesa Chali, and I'm a psychotherapist, relationship coach. My background is social work. I was born and raised in Zambia, came to the United States in 1999, and I live in the city of Menifee, California. Now, I hope I did put my slides in order. Hopefully they're gonna come in good order. Yes, so I went to school at Cal State San Bernardino, graduating with my bachelor's in 2004 and 2006, my master's in social work, and then went back to school in 2011, a small little school called Cal Southern University. And I completed my PsyD, which is a Doctor of Psychology in December 2017. Right now I'm working towards my clinical hours, completing my clinical hours and becoming a licensed psychologist in state of California. I'm married to Mr. Ricky Chali, my soulmate, my husband. And together we have 3 boys. I call them the Veen brothers. It's the oldest is Malvin, the middle one is Alvin, and the youngest is Calvin. So I have a football team at my house. I'm the only girl in this home. So, but well, it comes with its perks, right? And then this is my little family. This picture was taken last year on my 25th anniversary. I know I probably look 18, but I have a few years behind me. So we had our 25th anniversary last year, and so this is a picture we took for, and just a little bit about myself in terms of what I like to do. The group you see here called Tokoza USA, that's a group I sing in here in California. We just debuted our single, Our Prayer. I don't know if some of you have heard it, but if not, it's on YouTube. If you go to Tokoza USA, you'll find us there. And so I enjoy singing in my spare time. I love singing in my spare time. I love spending time with my family. And also I love church retreats and fellowships. So I was at the San Diego beach here with Azana. I don't know if you've ever heard of it. It's an Adventist group that, we meet every year. So we had gone to San Diego. And so it's part of what I like to do, retreats and, just enjoying myself. And other things I like to do is cooking, baking. I kind of got back into gardening, something that I really love to do. Since this COVID came by, I found some new interests. And so it's been a wonderful time doing all that. So that's a little bit about myself. After graduating, I was hired by a company called, a nonprofit called Family Service Agency of San Bernardino. I worked with them from 2006 to 2018. I started off as a clinician, then I ended up being their clinical director. I worked for another year and a half or so. And by then I decided I just wanted to focus on my private practice, which is Bridge Vision. By then I had opened it into a group practice. So I decided I wanted to move and do that. So I opened up my practice as a solo practitioner in 2015, upgraded to a group practice in 2016, currently working in the city of San Bernardino, mostly with low-income clients, Medicare and medical insurances and private insurances like Kaiser, and I also have Magellan. And then we also accept, fee-for-service, people who walk in and stuff like that. So it has become a little bit of a busy practice now. We have a lot of clients that come through the doors, especially through the county, because we do contract with the Department of Children and Family Services, that is CPS. And so we get a lot of parents that have children removed and they need to work on themselves to get back on track. So we do help them with that. And currently, because of the COVID situation, we're offering our services virtually. So we're not offering any in-office services right now. A little bit of an introduction on my mental health experience. My mental health experience as a social worker, the school I went to, we did a lot of what we call generalist work. So kind of like open to different kind of populations. We did different things. So other than just autism, I am not a specialist on autism, but behavioral health. I have I've worked with behavioral health, young people dealing with behaviors and all kinds of the different disorders that have to do with behavior, going on to adults with depression, anxiety, all kinds of different things. So I've kind of done different things within the county and Department of Behavioral Health. And then recently I decided I was going to focus on relationships. So currently I'm rebranding and trying to get into coaching and doing relationship coaching. I still do psychotherapy. I still have a couple of clients that I see for psychotherapy, but I do mainly, I'm trying to do mainly relational coaching. When it comes to mental health, I love the topic nuances, because I was just thinking to myself, I said, truly, the way we interpret mental health is so different. Everybody interprets it differently. The way it's dealt with is different. I'm sure most of you who grew up in Zambia coming to the United States will agree with me that we never really took these things so seriously. I mean, it was all labels, kinds of labels, Ishilu, Abapena, Wofunta, whatever it is, and that's all we saw it as. When we got here to the United States, we began to understand it differently because of the environment and the way it's, done. So we began to understand these things a little better. I'm sure some of you have had that uncle, auntie, where you're like, oh my goodness, you know what? Now I know that probably that was mental health issues, that I never really paid attention to. So we are learning so much, and mental health can be seen in many ways. It's not just one way. It can be experienced differently. And one of the things that I'm learning is that there's a gap between us parents who came to the United States as grown-up adults, the way we see things and the way mental health is affecting us, and our children who've been brought up here, whether they came in as small little children and kind of, grew up here, or they were born here. The issues they're facing are also a little bit different. I did hold a workshop a few months ago, and I did talk to adults and children. I mean, yeah, adults and young adults and parents and youth. So I had two groups, focus groups, and I did ask a lot of questions about mental health, and the responses I was getting, made me realize that, sometimes as parents, we don't know how to handle situations with our children when they're going through certain situations, especially mental health. And it's not on purpose, it's just that we've never been exposed to it that way. And on the other hand, our children are going through so much because they are really in this little gap in between, where they're trying to adapt to this American society, and they have to, deal with African parents who probably think a little different from what, how they think. So it's very interesting. And I'm really here today just to kind of, get started and hear some of the, what everybody has to say and some of the questions that you have. Mental health is a very broad topic. It's very broad. And so definitely no one person can specialize in everything. There's a lot of stuff that goes on, but, we are happy to be here and help out as much as we can. And, whatever we can be able to answer and maybe help out. And hopefully next time, Dr. Frida and Chita will let us come back again and maybe with a more focus on something. Thank you so much for letting me come in, and I'm waiting to hear from the rest of you. Thank you.
Thanks, Dr. Nomsa. We are excited to have you here and to help us get started with this conversation. Suliwo, I see you're on. I'll ask the same, maybe just give us a brief introduction of yourself and your prepared remarks before we go into the questions that the audience have previously submitted. And again, audience, if you have other questions, please enter those in the chat feature and I'll pose those to our guests today. All right, Suliwo, all yours.
Thanks. Hi, I hope everyone can hear and see me. Today of all days had technical difficulties after not having technical difficulties for a really long time. So I'm sitting in my car in a place where I think there's good enough signal, and hopefully I don't cut out, and hopefully I'm still able to spend this time with you all because I'm so excited to be here and to do this. I missed your introduction, Nomsa, so that really is bumming me out a bit, but just to let you guys know a little bit about myself, my name is Suliwo Nafunkwe, and I am Zambian by birth, have lived in different parts of the world, and I would have had a bunch of pictures to show you as I went through this, but again, my computer just kicked me off, so yeah, just bear with me on that. So yeah, lived in different parts of the world. I eventually went to the US when I was about 16 to study, and I got my bachelor's in criminal justice and psychology. And then I went on from there to get my master's degree in clinical mental health counseling. And then I practiced for a couple years and then decided that it was time to go home. And so came back to Zambia in 2012. And I've been here since then. I've spent the past 8 years working in the mining industry, helping them to develop a holistic wellness program. So that's really been my focus these past 8 years, has just been working with them and developing a holistic program that allows them to meet all of their wellness needs, including the mental health component. And obviously, because that that was my background, a lot of my emphasis was in creating a good EAP program for the organization that involved providing therapeutic support for anyone who needed it. So that's what I've been doing for the past 8 years here in Zambia. I am the last born of 5 children. All of my siblings are either living in the US or in Australia, so we're all pretty far apart. And my parents, my mom lives in America, she lives in Austin, Texas, and my dad lives here in Zambia with me, and we're privileged to be able to work together actually in the mental health space because he's a counselor as well. And it's coming back to Zambia has been a blessing in many ways. And one of those things is that I met my partner in crime here. So that's been an amazing journey to go on as well with him. So yeah, that's a bit about me, and more than happy to answer more questions as we go along, and just really looking forward to hearing what the thoughts are of all of you in attendance, what your questions are, and ways that we can best answer those for you.
Okay, so the first question I'll go into is around stigmas, and maybe just give an example of, you know, what is a stigma and why they exist, and what we can do to better educate ourselves and remove that barrier from, you know, people getting the help that they need. And then just to also add another flavor that's a little bit Zambian, we got a question around, you know, in our community, we have these witches, right? Older women who are found wandering at night. Do you think that is a lack of knowledge around mental illness and might be a sign of like early stages of dementia? Or, you know, how does, you know, the stigmas around mental health show up in a destructive way in our society, especially as Zambians? So let either one of you guys take that. Nomsa, you're on mute.
I'll let Sui take it.
Oh, okay. Yeah, no, that is a great question. And I think it's something that is addressed in lots of different cultural contexts and lots of different communities. But like you said, the stigmatization around mental health in Zambia, honestly, I think a lot of it just comes from a lack of knowledge and a lack of awareness of what mental health issues actually are. So like you said, you might find an older woman who's wandering around naked and incoherent, and because you don't have any words to put to that experience or to that scene, you kind of classify it based on what your cultural background or your cultural, you know, what the culture tells you this ought to be, right? And so then it's easier to say, okay, that person is probably, she's a witch, or, you know, maybe she's been lowered, or any other thing, which for us is an explanation to what we're seeing, because that's what it's about for us as human beings, right? We're always trying to put explanations to our experience to be able to say, this means this and this means that, in order for us to understand it and in order for us to move forward with it. So I think a lot of the stigmatization comes from a lack of understanding of what mental health issues are. And is it possible that some of these people who then end up getting abused and sometimes even killed in these contexts, is it possible that maybe they're just people who are struggling with mental health issues? Absolutely it is. But regardless, I honestly think that's a whole other question as well, as to the treatment of people when we find them in situations that are difficult for us to explain. But I think regardless, it's never okay for us to victimize people like that, especially to the point of taking their lives. I think we should always try to approach people in whatever contexts we're experiencing them and dealing with them. We should always try to approach them with an attitude of compassion and understanding, right? And I think in that vein, we're better able to understand what is actually going on.
All right, thanks, Willow. That is so well put. To kind of follow up with that, What about what can people on this call or we as a society do to better support our loved ones who might be in situations or exhibiting behavior we don't know how to classify, right? Or we know that, you know, it's a problem. A loved one is suddenly drinking a lot or, you know, talking to themselves or staying in bed all week for whatever reason. How do you know, engage them, right, in a way that doesn't alienate them, but is also helpful and gets them to a place, you know, to a better place? Because sometimes the loved ones who are experiencing these problems have that lack of knowledge, right? Sometimes, or they just don't want help or don't think it's a problem. So how do we navigate those situations?
Yes. I think first of all, in 2018, I did a presentation for Africans in diaspora for mental health awareness and stigma, right? And one of the things I was discovering, now I don't know because it's been a while, because most of my research was maybe 2013 and somewhere there. I don't know right now because number one, we don't have a wealth of information in terms of research on, you know, on Zambia and mental health. We do have, but not too much, right? And so I don't know right now as it stands, I haven't checked current numbers, but from the last time I did my research, one of the things I found out was that, you know, we have a long way to go. We have a long way to go in terms of getting to understand these mental health problems that people have in our country of Zambia. When I checked at that time, I think they said there was one psychologist and there was, I think, 2 psychiatrists or something like that, you know, so not much, you know, there's a lot, there's a lot of need, you know, so it's wonderful to see Sui there and, you know, doing her thing. You know, it's wonderful because I think then we're bridging gaps, but, you know, how much are we doing of that? You know, I don't know, because I think we need more, you know. There's a lot of movement, you know, from the motherland to here, and most of us are here and we're not helpful back home where they may need us, you know, for this. So there's not much development in those areas. Most of the things we know about mental health are based on what we know here, you know, the Western world. And so we can't always use all those criteria on individuals, you know, back home. So I think the first thing that I see as a problem is, first of all, education and awareness. We have a lot of work to do. It's even hard to talk about, you know, some of these issues when people are not even aware of, you know, how these issues, you know, are affecting them, or, you know, that these issues actually exist, because we see things like you just mentioned about the women who are wandering and, you know, they are taken in. A good example, I know there was a lady, I was watching a video a while back about a lady who came from I don't know if it was the United States or Europe, I'm not sure. She went to Zambia, and I think she took off her clothes. She was kind of having, I think, a breakdown. She might have been having a psychotic breakdown or something. And unfortunately, it was taken that she was a witch, you know, and they were taking videos of her. I mean, it was so sad. It was very sad to see all that. And all that because we misunderstand and we take issues believing that everything is witchcraft or whatever it may be. And so this woman didn't get the help that she needed. Instead, she got an embarrassment, you know, her family, you know, was exposed to all that. And it was very sad, you know. And we are, you know, for anyone who was watching that, for me, at least with my mental health eyes, I was able to see that I think she was probably having a psychotic breakdown or something. So I think those are the first things that we need to work on. We need to work on awareness and education for our people so that they can understand how to deal with these situations. Now, it depends, because in Zambia, it may be one thing. In America, it may be the other, because I think people are aware of mental health, but like you said, they just don't know how to help others who probably be having that problem, because you don't even have the right words. How many times have I heard somebody come to me and say, guess what? Once one of the young ladies was expressing her, you know, her need, you know, her problem of depression and what was going on. And one of one of the elderly women went to her and said, don't tell people about that. Now she found it very hard because she's trying to express herself and what she's going through. And community is saying, shut up, don't say anything, keep quiet, don't tell anybody about what you're facing. It's embarrassing or whatever it may be. It doesn't look right. Many times, you put something even online, you're talking about how you're feeling, how dark it is, and everybody's writing on the side, what's wrong with her? Why is she doing all that? Why, so you get all those kind of things. So the stigma can be very, very high. And so I think the first thing that we need to all do is to educate ourselves about mental health, understand mental health, find somebody who can explain to us what mental health is all about and how we can be sensitive, because no one person knows everything. So you have to be sensitive as to how to deal with an individual going through, because what somebody may be going through may be different from the other person. So it's not like one size fits all, so it's learning each individual, learning how you can support them, understanding, listening to them, and helping them through that.
If I can just add a bit to what Nomsa has said, I don't think there's any of us, especially with this year being everything that it has been, with COVID, with the stress that has come with that, with people losing jobs, with people just having to deal with isolation and just all of the different components of what this year has brought. And I don't even pretend to assume that this year has been the only hard year for some people. For some of us, it's a hard year compounded on many other hard years that we've had to deal with, right? And I think it's so important, number one, to be aware that it is okay and it is normal to struggle with life, because life is not always a bed of roses and life doesn't always give us everything that we want it to. And so sometimes life just gets to that point where we just can't cope anymore. So if you're faced with that, or if you've had to witness a family member who has been dealing with mental health issues or has just been struggling with life, number one, I think it's so important as a support person, as a support individual, as a family member, to be aware of the fact that their struggle, if they're close to you and it's someone you really love, is going to affect you as well. So it's very easy for the caregiver to feel like, I need to get my person into therapy, or I need to get them help, or I need to get them to the hospital, or whatever it is. And then they don't really think about the impact that whole situation has had even on them. So a lot of times I will get phone calls from worried family members or friends who say, I have a friend who has been drinking a lot more or who seems depressed. And my first thing with them is how are you doing? Maybe you should come in and let's have a chat as well, because I think it's important for you to take care of yourself, because if you don't, this whole situation can also cause you to end up spiraling and you to also end up having issues that you're dealing with. So number one, in answer to that question, I would just say, as the caregiver, also take time to take care of yourself if you have a family member who's struggling. But also know that the answer is not simple. I'm not going to be able to tell you in one webinar, hey, say this and say that, and all of a sudden your family member is going to want treatment, or they're going to understand that they have a problem, because it's never that simple. So I would encourage people just to talk to someone, talk to a therapist, figure out what's the best way for me to approach this situation. What's the best way for me to talk to this person who I care about? Because ultimately the issue is I care about someone and I want help for them, right? So work together with someone who maybe is objective and an outsider who can give you guidance and support in actually walking alongside your family member as they go through that difficulty. And hopefully together you get to a place where your family member either gets help or you are able to manage the difficulty of them not being interested in getting help or not wanting treatment, but you're able to take care of yourself as well. I hope that makes sense.
No, absolutely. I think it does. I think it comes with a lot of frustration when you want better for somebody that you love, but you're right. We take on their burden, right? We take on their pain and their hurt as well. So I think it's a it's a great point you made about taking care of ourselves first. Just to follow up there, are there specific resources, or do you think it's the same resources that you need if maybe you're going through the situation versus somebody who is a caregiver or a supporter? You know, are there specific resources available for caregivers versus, you know, a patient or somebody who's in crisis, or, you know, that kind of thing? Or would you just say the care is the same?
One of the things I've always done, like when I had the focus groups, one of the questions I asked people was, are you aware of any services in your community that you can go to? You know, are you able to tap into if you had somebody who was sick? I mean, someone who has mental health issues, problems, or yourself who's trying to get help for that person. Are you aware of some of the services? One of the things, some people say they did, some people say they didn't. But you know, nowadays with the computer, you know, technology that's upon us, all you need to do is just go to Dr. Google and just say mental health services near me, you know, and Dr. Google will bring all the different, you know, places that, you know, that you can find. So I don't know how good NAMI is in most of the areas in the United States, but NAMI is one for family members who have, you know, families that, you know, members who have mental health issues. So it's another place to tap into. Some areas it's not well developed, some areas it's really well developed, but it's a very good place to tap into, or you know, to get more information on how to support a person with mental health problems. Also, Chita, I was just gonna say quickly before we pass that topic, I was gonna say I have 7 important things I would like to, that you can use to reduce stigma and discrimination. For those of you who are trying to be like, how can I be helpful to somebody else that's going through, you know, stigma, and you know, how can I be helpful to, you know, towards, you know, helping others with mental health issues. The first one, like I said, was, and we mentioned that, is know the facts about it. Educate yourself about mental health problems, learn the facts instead of the myths. A lot of time we spend time talking about myths of mental health, things that are not even true. And so we don't help. We instead we make the situation worse, you know. The other one is, number 2 is beware of your attitudes and behaviors. We've all grown up with prejudices and judgmental thinking, but we can change the way we think. See people as unique human beings, not as labels or stereotypes. See the person beyond their mental illness. They have many other personal attributes that do not disappear just because they have a mental illness. And so many times when people have mental illness, we discount them. I did a survey asking about whether a person with bipolar disorder could be a governor. I got a lot of mixed answers because people thought he couldn't govern because he has bipolar, so he probably won't do a good job. They had all these things, and that is based on what somebody thinks, not what is the truth. Because it doesn't mean that because someone has bipolar, then they cannot function and they cannot lead a country or whatever it may be. You know, they just need the right help, right? And then the other one is choose your words carefully. The way we speak can affect the way other people think and speak. Don't use hurtful or derogatory language. Be careful what you say to others, because sometimes you just think I'm just saying it. I didn't, you know, that person, that crazy person or whatever. You know, you have to be careful what you say. Choose your words carefully. Educate others. Find opportunities to pass on facts and positive attitudes about people with mental health issues, problems. If your friends, family, co-workers, or even the media present information that is not true, challenge their myths and stereotypes. Let them know that their negative words and incorrect descriptions affects people with mental health problems by keeping alive the false ideas. Focus on the positive. People with mental health and substance use problems make valuable contributions to society. Like I said, their health problems are just one part of who they are. We've all heard of the negative stories. Let's recognize and applaud the positive ones, right? Support people. Treat people who have mental health problems with dignity and respect. think about how you would like others to act towards you if you were in the same situation. If you have a family member, friends or co-workers with substance use or mental health problems, support their choices and encourage their efforts to get well. Lastly, include everyone. In the USA, it is against the law for employers and people who provide services to discriminate against people with mental health, substance use problems, denying people access to things such as jobs, housing, and healthcare, which the rest of us take for granted, violates human rights. And it can be not that you're an employer, it can be just anything else, because sometimes even within yourself, ask yourself, how have you been helpful to somebody who has mental health issues? So we have to make sure that we are on board to learn about mental health issues, and also to be on board to be the support system that those people need in order to be able to succeed.
Yep. Thank you, Nomsa. That is, Will, I saw you get off mute. Did you want to add to that?
Well, I would just add, like, from the Zambian context, I know you were saying, is the service support different for caregivers than it is for individuals who might be struggling themselves with specific mental health issues? And I know that in Zambia, there are a lot of people, when they think about caregivers as well and caregiver support, you might think of things like Al-Anon to support people who have family members who are struggling with substance or alcohol abuse issues. And I know that in Lusaka and on the Copper Belt, there are some Al-Anon groups that are available. So if anyone is interested in finding out where these are located or how to get connected with those, you're more than welcome to contact me when we're done with the webinar, and I'll be more than happy to share resources, even through you and through Innovatus, for anyone who wants to connect in those ways. And then there's also a whole lot of really great practitioners who are doing wonderful work out here. I know that over the years, there's been a shortage of mental health support in Zambia, but the numbers of people who have grown a passion and have actually started to enter into this space and into this field has increased greatly. So there's lots of different avenues that you can go to actually get support in managing being a caregiver, or if you're having difficulties with mental health challenges, there's definitely places where you can go and people you can go to. I know there's an organization called Psych Health. There's an organization called Renaissance, and that's just two of a few that I can just spout off the top of my head, along with other therapists that are based in Lusaka, and a few on the Copper Belt, not as many as in Lusaka, but a few. So there are resources out there. I would hate for people to feel that, you know, because maybe 5 years ago you heard, oh, there's no one available, you might feel that that's still the case now, but there are people available. So please don't feel like you have to journey alone or struggle in silence. There are people who are available to help and to support.
Okay. I just wanted to ask one quick question on support before moving on to another. But if one of you could quickly answer, somebody asked, what can people do to ensure that they're not overlooking something in their, direct sphere? So their family member or, loved ones are going through things. And I think for most people, they journey at it alone because it's isolating, right? And it's hard to talk about. You have to be brave to share. What can people do to kind of be on the lookout and be there for others?
I'll say this. Number one, I think it's so important that we acknowledge the fact that there are some things we might miss. Okay, because I know that a lot of times caregivers can have a huge sense of guilt when a family member comes out and says, I've been struggling with depression for 5 years. And you're like, but I had no clue. I had no idea. And then there can be a guilt that comes along with that. And I want you to know as a caregiver that it's okay that sometimes you might miss things, because mental health is not like a broken leg or a huge gash to your forehead, right? Those things, those wounds, those injuries you can see. But when someone is struggling with a mental health issue, it's between them and whoever they choose to share that story with, unless of course it's manifesting in a very visible way. And so that's why a lot of people can and do struggle on their own for a very long period of time. So one of the best things that you can do as a caregiver, as a friend, as a loved one, is to ask intentional questions of those people in your sphere. So don't be afraid to ask real questions, right? So don't be afraid to be like, hey, how's it going? And really want to know the answer. And when someone's like, it's okay, pursue that response. Be like, what does that mean? When you say, it's just okay, what does just okay mean? Okay, let's talk about that more, and engage with the people that are around you. Ask them more questions. And also just, if you know someone well enough, pay attention to the differences that you're seeing, especially when it comes to individuals who are struggling with suicidal ideation. A lot of times that struggle is very difficult to articulate to other people and to share with other people. But as a caregiver, as a friend, or as a family member, as a colleague, you might start to see some differences in someone who you know well enough. You might start to see they withdraw a little bit more, or you might even start to see that they start engaging in kind of like saying goodbye behavior. So, saying, hey man, I really appreciated you over these past years. Or, maybe if you're in an American context, they might say that. Or maybe in Zambia, we might start things like Mune, it's been real, I've really enjoyed this friendship. It has really meant a lot to me, And so it looks different in different contexts, right? But saying goodbye behaviors, start looking out for some of those things. And sorry, I'm disappearing into the blackness, and I am black. But yeah, just start looking out for these things which look different. And when you see differences in people, I cannot emphasize this enough. Go to them and talk about it. Don't go to your sister and say, hey, have you noticed that Mwaka, she's started to gain weight and she stopped talking to us? And Mwaka is your other sister, right? You just go to the person, talk to them and ask them, hey, I've noticed these things. I've seen these things. What's going on? Is everything okay?
Yes. And also,
Absolutely.
Just like Sui has said, I can't even add more because I know she just said everything. She summed it up so well. The truth of the matter is that, yeah, you can never be always prepared to, you may not always know that somebody's going through something, especially because of the stigmas that exist and people don't want to be labeled, and there's two reasons, it could be the stigma. Sometimes it could just be that the person has not received support when they've talked about what they're feeling. So they've kind of shut down. And so because of all that, you know, and if you're a person who doesn't pay attention to things around you, you probably won't pick it. So I think one of the things I can only say is be very aware of your surroundings and be aware of others, be sensitive to others. And you probably, especially with somebody who you're close to, you probably pick something because you may see a change in behavior. You may see, withdrawal, isolating, maybe, sadness, maybe a little bit, teary or whatever it may be. And you can notice that there's a difference. And then you kick into exactly what Sui was saying, kind of engaging the person, getting to ask them more questions and also not overdoing it, because sometimes we find ourselves overdoing things because now we're like thinking, we don't want to miss if this person has a problem, we don't want to miss it. So you overdo things, and that can be also annoying and irritating for the person who's going through it, because it's not like they're asking for, added attention or something. Not everybody asks for that. So you have to kind of just go with the flow, but also find ways that you can always kind of be in tune with people's behaviors, especially people you are close to and you are aware of. Don't take things for granted.
All right, segue a little bit, I wanted to talk about a specific form of intervention, which is medication. I think, especially in the US, I think that comes with a negative connotation because, some people think the system is trying to push pills, right? But can we talk about medication as a form of intervention? There's a lot of stigma around it. What are the adverse effects of say maybe a misdiagnosis, right? Because I think that's the fear. I don't want to take medicine for something I don't really have. What if it's the wrong thing? What could be the negative side effects of taking medication? But then how can medication really help people who are going through things? So yeah, if you can just touch a little bit on medication as an intervention, just to share some knowledge around it, because it's this hazy thing, and I think a lot of hesitation comes with it.
Yeah, well, both me and Sui, I'm sure she'll also agree with me. We're not, we're not psychiatrists, so we don't necessarily, go into that realm of medication. But like you say it from experience, what I see is that I do have clients. When I see clients, there are some clients that I encourage to go and do a meds eval, as we call it, so that they go for a psychiatric eval, and then the psychiatrist will let them know, if they need medication or stuff like that. And then I'm not a proponent for medication, but at the same time, I know that there are people who need it, right? If somebody is having, psychosis, or is having a hard time, coping, they're having those vegetative symptoms of depression, whatever it may be. You see that they're not coping well. Number one, they're not doing their ADLs, that's daily, living activities of daily living. If somebody's at that point where they can't work, they can't do anything, and you can see that it's affecting their day-to-day life, whether with interpersonal life, whether with, career, maybe it's a point where you can say, you know what, you need to see a doctor. Now, I will be the first to say, I know that right now, medication, the issue of medication is a hot topic, because not only people who are scared to take medication, but also, what's out there, because clearly there's many reasons why mental health happens, right? We have, psychological, environmental, biological, whatever it may be, issues that may cause, someone to have a mental breakdown. So the thing is, it's something that's not going to be well accepted by everyone. I do have clients that go to, I'll send them to a psychiatrist, and they will be like, no, I don't think so. They, did you take your medication? No, they didn't. And I've seen some, get worse and worse. They become very psychotic, and they're not even functioning well, because they got off their meds. And then I've seen some who said, no, I don't want to. And they try to look at other holistic ways they can work on themselves, and they do well. So it's really, I don't know, it's kind of like this, because the theory of the chemical imbalance in the body is one that others will refute and say, hey, no, we don't really believe in that. But at the same time, that's what, it is. It's like individuals may have an imbalance, and they may want to take medication so that they can balance up and be able to, function well in society. So yeah, there's a lot out there. I think it goes case by case, and depending on the individual or the circumstances, I would be able to insist on one to go see a psychiatrist. And then there will be times when I'm like, you can manage if only you can be able to do ABCD. So it's kind of like this. I don't know what Sui thinks about that. I'll let her speak to that.
Yeah, medication, I feel like it's always such a difficult topic with clients, with family members. It's always a tough one, because I think, and I'm not going to speak for everyone, but I think for a majority of people, there's almost a sense that if I have to take medications for this, then I really am far gone, or like the levels or the degrees in which I am not okay are just out of this world. Therefore, I have to take medication. And one of the things that I love to do with my clients specifically is just to highlight to them that, number one, medication is a spectrum. It's a very broad spectrum, right? So if you go into hospital and you say, oh, I've got a little bit of a headache, I'm managing, but it's kind of irritating me. Okay. Your doctor might say, okay, take some ibuprofen and take one tablet of ibuprofen, and that should be good. You should be fine. But if you go into hospital and your leg has fallen off and you have a headache and you have so many different pains in your body, they're going to give you the strongest stuff that they can. So they'll give you morphine and things which are going to be able to combat the level of pain that you're experiencing. So I always like my clients to be aware that just because we say medication, it doesn't mean you're going to be on something extremely strong or powerful or, you know, something that's going to knock you out. But if you did need that, it would definitely be worth it for getting you to be at the point where you can function in a way that you are at your very best. And medication isn't always just a pill you take. As someone who has focused on holistic wellness for a long time, I'm also a huge proponent, advocate, in my practice of utilizing natural medicines that we have around us. So what are you eating? What's your nutritional practices like? Because some of those things can actually help you manage some of the things that you're feeling and some of the things that you're experiencing. So just the same way you might go to the doctor and he might start you out with the Bruston, and if that doesn't heal your headache, then they might progress in what they give you. I always encourage people and tell them, hey, maybe let's just start here. Let's start with looking at your diet and what you're eating. If we make some changes there and it doesn't help, then let's talk about going to see a psychiatrist and see what medications we can get you on to help with the situation. So a lot of times people think it's all or nothing, and it doesn't have to be that way. Sometimes it's needed and sometimes it's not. And I think for each of us on whatever path or whatever journey we're on in managing or dealing with things, hopefully you're working with someone who can walk alongside you in that and help you determine what is actually going to be best for you, and what's actually going to work the best for you. So hopefully people don't get terrified that if I go to see a psychologist or psychiatrist that they will put me on medication. Because even psychiatrists sometimes will say, you don't need medication or you do need medication. It really just depends on what's going on and what's going to be the best treatment to help you get to the point that you can be at your best.
Okay. You bring up, like, I feel like that's a segue to a really good question I have, but I also want to let the audience ask questions. So if there's anybody who wants to come off speaker and ask their question, I'll invite you to do so. But if there aren't any, I have a few more. Okay, so one quick question around that. Somebody asked, what does it look like? What does a session look like when somebody is a patient and comes to see one of you, right? Like, what does a therapy session or counseling session look like? Like, what happens? And I know both of you guys, you know, are in that space. So if maybe you could just like demystify what that treatment course looks like.
Well, on a typical day when I get a client that comes in to see me, let me start from the beginning. So of course we meet up and we do an intake. Within that intake, there's a part where we do demographics. We'll ask questions on client, address, whatever, all the kind of identifying information. Then they'll come in to see me, and with me they will do what we call an assessment, an intake assessment. And in that assessment, I will be asking background questions like family. First of all, I'll ask them what their presenting problem. So I'll need to know what their presenting problem is. So they'll explain to me what's going on, how long it's been going on, and they'll give me all their symptoms. In my practice, I have what we call a quick screen. So I try to, there's a lot of symptoms there. And so I try to have them fill out all those symptoms for me before they come in, so I can kind of pick up and see what's going on. What's the general idea I'm having here? Is it depression? Is it this and that, whatever it may be? So they'll do that. And then they'll do the presenting problem. Then I'll look at their history. I'll look at their mental status. Mental status just simply means it's a mini one. So I kind of look at, are they alert? What's their mood like? Are they being objective? Are they, their insight, all those kind of things, their judgment, their, I'm trying to remember, if they're having any auditory hallucinations, basically hallucinations, and, all kinds of different things, just to make sure that, they're here with me and we're in the same place, so ask questions like, time and what is the situation right now, for coherency. And then from there, we kind of finish off putting down all the stuff that I need from their background. So their family background is very important. Why is family background important? Because I just want to know, is there somebody else who has those problems in their family? Is it the first time, or does anyone else have problems? Are you suicidal? So we'll go through the, ruling out suicidal ideations and homicidal ideations. And if they do have those, then it's another issue. We kind of go down and see what's going on with them. And then from there, I give them a working diagnosis. And the following week, I have them go back home and I tell them to think about what they want to work on. What are some of the treatment goals they're looking at? What are they trying to work on? So that the following week we come back and we kind of work on a treatment plan. And then after that, we go into sessions. So every week they come in, we figure out where they are at that week, and then what we're going to discuss on trying to build their goals and objectives that we kind of came up with.
Okay.
Yeah. So not much really to add to the process. You covered it very thoroughly. I think it's always a very daunting experience for people coming into therapy for the first time. They don't know what to expect. They have references, whether it's something they've seen on TV, someone lying down on a couch and having someone listen to them as they kind of talk about their life, or, whatever other rendition they've seen of that on TV, on Billionaires or any other show.
Yeah.
I think one of the most important things for people to know about when they come in for a therapeutic process or for sessions is your therapist is going to want to make sure that the environment they create with you is comfortable for you to be able to reveal and talk about what matters most to you. Because when we talk about people struggling on their own, people struggling without telling anyone else, and can do that for many years, sometimes throughout their whole lives, the reason that's the case is because it's not easy to open up about some of those things that we're struggling with. So the most important thing for us as therapists, as practitioners, is to create an environment where you can get to the place where you can start to share that with us. And I am yet to experience that in the first session with a client, that they're like, I'm ready to tell you everything, but it is about developing a relationship where you get to the point where we can deal with everything, where we can talk about everything that's going on with you, so that we can give you the tools to equip you to be able to deal with these things in real life, in real time. And I know I lived and worked in California for a while, and everyone has a therapist, and a lot of the times they have a therapist for a very long time. And sometimes that's necessary and sometimes that's important, but going into therapy also doesn't necessarily mean that you're going to be in it for a very long time. A lot of the times I tell my clients, I am committed to working myself out of a job with you as quickly as possible, because I don't want you to depend on me or this relationship. I want you to be able to do this on your own out there. So what I would want people to know is that, number one, someone is going to try and create a safe environment for you to be able to talk about what you need to talk about. And we have so many things in place that allow us to do that. I'm sure you've heard the term confidentiality, that the relationship between the therapist and the client is a confidential one. So that's hugely important for that process, that it is what's discussed between us is confidential. And man, can I just emphasize, especially in the Zambian context, for any therapists who are professionally practicing in Zambia, they will hold to that. Because I know a lot of times people are afraid that, what if I go and then my pastor finds out and my father finds out? Because that's just what happens. Is like, if you share something with someone, they share it with the whole community. Sometimes it's under the guise of, let's pray for Sister Mwape, and I don't want to be prayed for about that. I don't need that thing to be prayed for, And so please know that if you come to see a therapist, that we will make sure that we uphold confidentiality with you. And there are some limitations to that, and we will tell you about that when you come in to see us, but we will uphold that so that the environment we create is safe. And if you're not going to connect with me as a therapist, you better believe that I'm going to help you find a therapist that you can connect with, so that you can get the help that you need and that you can achieve what it is that you need to achieve. Because I think all of us know struggling with emotional difficulties is hard. And the quicker we can get through it and the more support we can have getting through it, it's critical for all of us. And I think that is foundationally what's important to us as therapists, is that you find that space where you can deal, you know?
Yeah.
So, yeah.
No, I love that. Thank you both. That was a well-seasoned piece of meat for us to chew on. So thank you. One other question I do have, it came up in the chat. Somebody asked about, and I'm glad you brought it back to Zambia, is the gender differences and how we think of mental health, right? I think we all go through it, but somebody made the analogy that for a woman who's found wandering, she's a witch, right? But for a man, he's the resident madman, right? He could be wandering, and that's what he does all day in and out. He wanders the streets, but he's not considered a witch, right? He's just Varipena. And I remember growing up with a guy like that, Benja, and when he died, it kind of rippled through everybody in the diaspora who knew Benja. It was like, Benja Nafwa, you know what I mean? Like he was our resident madman, and it was a little bit of home, right? But I don't think that a woman would have been viewed the same way. And then there were women who had other things, but I think we judge them a little bit differently. Can you address that? And also maybe talk to the women on this call, because I think especially in the home, we take on a lot of the emotional burden and the wellness of our families. So how do we navigate that? I know the resident madman is an extreme, but even just like in the home, how do we navigate that and make sure that our women are getting the care that they need?
I guess I can start. Yeah. Oh my word. I think I just think back to any kind of cultural change or revolution that has ever happened in any space. It takes people being brave enough to speak their story and to speak it as it truly is. So one of the things, like, especially, I mean, yes, there's a case of the madman or the witch, but one of the things, especially that I notice, especially in the Zambian culture, as far as gender disparity, is when it comes to women specifically, they're expected to be. We're expected in the Zambian context to be superheroes, especially around like childbirth and child rearing and having a home. We're expected to be able to do it all, do everything, and be able to deal with whatever comes our way and not complain about it. So my husband is cheating on me, my babies are crying, this one is sick, and guess what? I'm just supposed to suck it up and deal with it, because that's what we do. That's just how it is. You know, you might even go and talk to a friend and you might say, what am I supposed to do? My husband is, you know, he's got his side chicks, and what am I, you know, I'm feeling some, no, they're men are men. That's what they do, you know? And then we're kind of forced to kind of exist in this space of, oh, that's just how it is. Or worse still, when women have miscarriages in our culture, they're expected to just get over it. It's like, I've just lost a child, but I'm supposed to get over it and move on. I've heard there was one case where a woman that I was working with had been told, it's okay, mwala, sorry, I'm not very good at them, but you fialwa again, wala, you have another child. You can have, you have another child, and you've got the other ones at home. So don't worry about that one. Oh, like my heart hurts for that woman, because it's not as simple as that. Grieving for the loss of anyone, a child, is not as simple as that. So what would I say to women, to men in the Zambian context? Be brave to tell your story and tell it as it is. So be brave to say, no, I'm not okay with that. No, I'm not okay. No, it doesn't feel right to me to have to get over the loss of a child. Or no, it doesn't feel right to me that my husband is cheating on me, or that my friends are gossiping about me. It doesn't feel right to me. Because when we start to share our stories with each other like that, and in that way, I think we start to change how we talk about and how we perceive the roles, the gender roles in our cultures amongst one another.
Powerful. You know, one of the things, that I have noticed in doing this work is we still have a long way to go when it comes to gender disparity. And it's an issue in Africa, it's an issue in America, it's an issue everywhere, you know. I mean, we're excited that we have the first vice president, Kamala, female here in the United States of all places. It has taken them all this time to, just a female. We're not even talking black or whatever, just a female. So you can imagine that we have a long way to go as a society to, to equality. There's a lot of things that women are suffering in silence, especially in our cultures where, everything is shipikisha club, as they call it. So like, Sui has just said it very well. I mean, I can't even add more to it. It's really a very sad situation because if you're being told that you should shipikisha, that's the culture that we have, shipikisha. So how many of you, if you're married, you've done your you've done your kitchen party and all those things? The first thing that you learn is, shipikisha. You welcome to the shipikisha club. Why does that have to be drilled in our heads that you have to be in a shipikisha club? So you can imagine that somebody who's going through so much pain, like Sui just mentioned, she's lost her child, she has to shipikisha, It's okay, you have another one. I know that story very well because it has happened to me. So, it's okay, you have another one. But, what you're not understanding is that I'm still grieving this one, and I need your support and I need you to help me through it. So, and then when it comes to matters of domestic violence, a lot of women, I don't know if you have that auntie, that cousin, that friend, that just looks like they're not okay anymore. They just look like something is wrong because they've gone through so much abuse, psychological abuse. Sometimes it's not even, physical, psychological abuse, that they don't seem okay anymore. And you're wondering, like, what's wrong with them? But they probably are very depressed and they don't even know how to handle that, or they've never gotten any help and they just think they have to keep on going just like that, So these issues are very prevalent and they're still going on. And like Sue is saying, I mean, we need to get where, where we are able to be empowered to, to tell our own story. But how do we get there? How do we get there? Because there's a lot of work that still needs to be done to be able to get to that point where we can even tell our story. In terms of awareness and everything else. Especially if you don't have a supportive husband or somebody that, family that is close to you.
Yep. No, I think what Sue said is it really takes a brave act, because sometimes, it takes a lot for somebody to muster up the courage to want to share their story, but then the first person they tell, their reaction is bad. And so it makes you want to retreat. But yes, if people have stories to tell or want to empower, even just like their friend group, I encourage you guys to leave boldly, right? Walk boldly in your truth, as we will put it. But I know we are 5 minutes over. This has been a very great discussion, and I think very enlightening for me, but I hope the audience took away so much from it. Again, if you have questions, feel free to send those in and we'll get Willow and Nomsa to respond to those, and we'll send those out to the group. And we want to encourage you guys to keep learning. They shared a few resources. Please tap into those, but talk to your, again, challenge it, talk to your friend groups, talk to your families, bring it up at Thanksgiving. Hey, auntie, whatever, what can we do about her? You know what I mean? Like, make it, bring up those conversations. I think we all see it and we're all thinking about it, but nobody is brave enough. So I encourage this group to be the brave ones. Before we go, Willow, I did finally get your pictures up. I'm so glad you were able to be with us, and I think they're so good. So I want us to see them. So I don't know if you want to talk through them. I'll share my screen. So we're not missing out. So I don't know if you can see the screen, but it's on the first picture with your parents.
Yes, I can. So those are my parents, Joe and Alice, when they got married. I think my dad was 25, 26, and my mom was 22 at the time. So yeah, they met, they fell in love, and then they procreated. And five babies later. was the rest of our family. So that's me and my siblings and my small mother. My small mother is the one in the back in the beige jacket. So those are my siblings. That was when we were living in Lusaka before we left Zambia to go to Australia. I'm the little one kind of hidden away there because my fikutis were not on point. And my siblings. My siblings are going to kill me for that. But yeah, this is my family. This is my family now. All of my siblings have given me beautiful nieces and nephews, which I am so grateful for. I love being an aunt. Like I said, my siblings are all living in the US, except for one, the one who's in the bottom left corner. Him and his daughter live in Australia. So that's my brother Gome and his daughter Zamaya. And next to him are my sisters, Tamira and Siwo, beautiful women, lovely women. If you live in America in the Texas area, hit them up because they are phenomenal. And yeah, that picture right there is me and my comrade. That's me and my partner Jonas, who we met here in Zambia 6 years ago, and are still getting to know each other. So, yep, that's him.
Okay, I want to share a better picture. I don't know if that's better. And then you doing leisure.
Yeah, and then just some things that for me I do for self-care. So self-care is talked about a lot. It's a very popular phrase for everyone. And for me, staying well and staying rooted and staying grounded involves getting out, doing adventurous things. I love the outdoors. I love nature. I love spending time with people I love. That's me cuddling with my nephew. I love being with my family, people I care about. That really just fuels me and gives me life. I love eating well. I love eating in general. I'm going to be honest. I love food, but I love to eat good food when I'm in a good place. When I'm not in a good place, the food gets progressively not so good. But I love eating well. That helps me take care of myself. And I love working out and being active. So those are just some things about me that help me stay well and stay okay.
Thank you so much, both of you, for sharing pieces of you with us and the information. I think it was a great session. Everybody's reacting in the chat box, and I think the reactions are positive. Dr. Frida, do you have any remarks before we sign out for the day?
Yeah, no, thank you so very much, Dr. Nomsa, Chali, and Willow, for sharing with us not only about your families, but also the information around the nuances of mental wellness. I want to thank each and every one of you for taking time out of your Saturday morning or afternoon or evening, depending on where you are, to be with us today, because we all know that it's pretty timely, this whole conversation around mental wellness and just really not only taking care of ourselves as caregivers, but also taking care of others that might be around us and becoming more aware. I'm going to share a joke and then I'm going to give to you 3 takeaways. Here's the joke. I have a young 18-year-old daughter, and when she was much younger, we had cooked food. And I said, Tyler, serve other people. She goes, no, Mom. She goes, haven't you seen on planes, they say, take care of yourself first before you take care of others. So she was like, I have to take care of myself first. Let me feed myself first before I can give anybody else any food. But that's the joke. Here's the 3 takeaways that I'd like to share with each and every one of you. You all heard about education and awareness. None of us are experts on mental wealth. I mean, I think you see our President in the United States, he's showcasing some elements of mental opportunities, right? So each of us have to continue educating ourselves, becoming more aware of what resources are there for how we can become better knowledgeable about mental wellness. Secondly, I want you all to meet people where they are. It's not about you, it's about the person's experience. Being able to understand and be empathetic and compassionate with where people are will help, because we, by default, we overlay whatever we see based on what we've experienced, but meet people where they are. And last, if you change the way you look at things, the things that you look at will change. So with that said, I wish you all for those on the state side, a fantastic Thanksgiving. Once again, I give thanks for each of you for taking time to be with us on today's Brunch and Learn. We hope that you learned something new. We thank you for your time and look forward to our last Brunch and Learn for this year, which is going to be around spirituality. It's December. It's a good time for us to give an opportunity to that whole period around December. So with that said, thank you so very much. And Chita, you did an amazing job. Thank you so much for everything that you all do. And I also want to share and thank the team that works hard to pull these Brunch and Learns together. It's not a one-man show. Everybody pulls in. So thank you so much. Chita, over back to you.